morning. This is my NUR2102 Lily Honeyman U1176480. Patient overview. Mrs. Zia Wang is a 94-year-old woman. She normally lives in an aged care facility and uses a walker. She has just returned from theatre following a total left hip replacement following a fractured neck of femur. After surgery, Mrs. Zia is experiencing hypertension, dehydration, lethargia, and is clinically fragile. Additionally, she has elevated inflammatory markers and impaired renal function. This puts her at risk of acute kidney injury, infection, delirium, and bleeding. She has a history of hypertension, osteoporosis, rheumatoid arthritis, and history of stroke. She requires intravenous antibiotics, fluids, analgesia, close monitoring, and neurovascular observations. To manage Mrs. Wang's chronic conditions during recovery, her regular medications have been continued. As she is currently hypertensive, Adenol helps treat hypotension. However, her blood pressure should be checked before administration. Additionally, she has osteoporosis, calcium carbonate, and risedronate helps to manage this and reduce risk of a fracture in the future. Diclofenac gel helps provide pain relief for osteoarthritis with less risk of systematic side effects than oral NSAIDs. Because of Mrs. Wang's age and post-operative condition, her vital signs should be closely monitored and response to these medications should be closely monitored. These medications help to prevent complications that hip replacement surgery can cause, such as infection, venous thromboembolism, and pain. Due to Mrs. Wang's age, recent surgery, reduced mobility, she requires to be closely monitored for infection, bleeding, pain control, and medication side effects. To treat post-operative complications, these medications are prescribed as needed, as fentanyl can cause respiratory depression and hypertension. It is important to monitor the patient's blood pressure, respiratory rate, sedation score, and amount of pain. After anesthesia and opioid use, metoclopramide is recommended to relieve nausea and vomiting while watching for adverse effects like extrapyramidal symptoms and drowsiness. Given her age and recent surgery, she is more prone to developing delirium, which can be treated with haloperidol. Additionally, to help prevent infection, gentamicin is used as a single intravenous antibiotic. However, gentamicin requires extra caution as Mrs. Wang already has reduced renal function. Mrs. Wang has no known allergies. Giving her medications is less likely to cause an allergic reaction. Enoxaparin, fentanyl, oxycodone, naloxone, and gentamicin are some of her high-risk drugs, so close observation is important. While fentanyl and oxycodone can cause respiratory depression, drowsiness, and falls, enoxaparin raises the risk of bleeding. Mrs. Wang's decreased renal function increases her risk of kidney impacts. She should be kept an eye on her vital signs, pain and sedation scores, renal function, wound and belly vac drain output, neurovascular observations, and IV cannula site during her treatment. Additionally, she is prescribed enoxaparin, TED stockings, and should be moved as soon as it is safe to do so to lower the risk of venous thromboembolism after hip surgery. My nursing priorities include managing Mrs. Wang's pain while monitoring for analgesic side effects, preventing infection by giving antibiotics and evaluating her wound, and lowering the risk of venous thromboembolism with enoxaparin. TED stockings and early immobilization are my top nursing priorities. She is hypertensive and clinically dehydrated, so her hydration and blood pressure should be monitored. Vital signs, pain and sedative ratings, neurovascular observations of the operative wound, limb and belly vac drain output, and renal functions are examples of ongoing evaluation. As her age is higher and recent surgery, monitoring for indications of decline, such as worsening hypertension, decreased urine production, bleeding, infection, and growing disorientation, so that any issues can be identified and treated. Here are my references. Thank you for listening.